guys, what is going on? So back at it. I hope you enjoyed the videos, Dental Talk. There's a series of 4 of them, and it's a really good look, I think, inside the day-to-day. We had this really cool set of patients and procedures that I want to talk about. So we're back with Dental Director Matthew, and I thought about showing you the videos, and I will, but it doesn't make any sense unless you know what you're looking at. So that's definitely not me. We're going to talk to Matthew, so here we go. All right, Matthew, how's it going?
Hey, how's it going, Alan? Good to see you.
Yeah, always. All right, so we're gonna have our candid conversation. So sit you guys down here. Let's make sure that adjusts. All right, let's do a sound test. So say something.
Perfect. Hi, everybody.
All right, we gotta boost that a little bit. Try again.
Hello, hello.
All right, that's better, much better.
Yeah, you gotta hear us. This is important.
Oh, I think so. Okay. Yeah, I think that looks good.
Excellent.
Good. Okay, so it's always good to be back, and then it's a super wide angle, so it actually catching the left of your shoulder there.
Oh, is it really nice?
All the way to the potted plant.
All right, excellent.
So that's a nice, good view. What I told our YouTube audience was that Elegant had the batch of patients, one in particular that was really memorable, and that had to do with multiple implants.
Yep.
But there were some complications. So what I wanted to do was overlay that video with some of the explanations so that we can break it down step by step.
Perfect.
And to give you guys a better idea of what it's like to go in for an implant. Right, now you know what an implant is, now you know what to look out for with your own insurance companies, how to get the best care with your dentist, or maybe even looking for a new dentist. So that was in the 4-part series, the last 4 videos, I think. One of the last 4, and I'll link that somewhere. I'll link that for you. But go check that out if you haven't seen those. And then right now, let's say you got through all of those steps. What do you do, and what can you expect rolling in? Right, you got your implant booked, you've got all your CT scans, you have your comprehensive dental exam done. What can you expect, and then what's that actually like, right? And we're also gonna have patient testimonials too.
Yeah.
That's for another day. Right now we're just talking about the nitty-gritty. So
Perfect.
wherever you want to begin.
All right, so ideally, whenever you're interested in getting implants, and like Alan was saying, you want to have your comp exam and previous diagnosis from your existing provider. And then, of course, your CT's done. Now, all that information is important. So your provider and your specialist is going to be doing the implant placement, the surgery. They need to see, basically, without having your PAs, which are your little small x-rays that they normally take on your visit. They call them FMXs, so it's like all remaining teeth in your mouth. They'll take those. CT scan is extremely important. So I'll just kind of back up a little bit. So with a CT scan, the reason why you get that, and again, it's very necessary to see, it's almost like an MRI. Without a CT scan specialist and any provider that's placing an implant, they're not going to know what is in your mouth. They're not going to know where things are. So with the CT scan, they can see everything by the slice. They can go in there and actually understand where your nerves are, where your sinus is at, all the anatomical landmarks, and take measurements. That's really the biggest key factor to having a CT scan done. You have to take measurements. You've got to know where parts are going to be at, how long an implant's going to be, how much bone is available. So all that's very important for the CT scan done. So I bring that up only because I've had some patients, ask me, it's like, why do I need that when I've had all these other x-rays done? And that's the reason, because we need to take measurements, and it's very difficult to do on a small little x-ray, little PA, accurately. So as you go along, and we have that information, the specialist takes a look at it. It's all coordinated, it's all discussed, it's all planned. We find out exactly what, again, available bone you have. A lot of people have the misconception that it's like, okay, I've got the money, I want to place an implant in an empty space. Here's my money, give me my implant. It doesn't really work like that. You really need to be authorized. You need to be a candidate for dental implants. And again, doing it early is not necessarily preventative, but it's a necessity for a good, successful implant placement. Waiting until you're at an advanced stage, you might not have the available bone. So you want to be on top of that, and that's what we focus on. So again, having the implants planned and coordinated with the specialist, reviewed, and then we figure out exactly what you can have. Then we discuss that ad nauseum between each other before we even get to the point where you're coming in and have your implants placed. So that's huge. And I know Alan, he's been around with us and he understands where we start, why we do what we do, and why we discuss and explain and coordinate the quality of care for an implant placement. It might seem easy, but it's really not. There's a lot of that goes into it, and there's a ton of planning and coordination. And when you start to get to ground zero, like we're going to start placing your implants on this date, we give you a date. The biggest contradictions that we have to figure out is your health. It's not too common, really, that we get patients that are completely grade A healthy, because at some point, we're going to have issues. We're going to have lung problems or health problems, heart problems, anything, and everything that you're taking in your body, including a vitamin. It could be something as simple as a vitamin that could cause an issue. We are always on the lookout for patients that have any issues health-wise, specifically with blood disorders, anything to do with heart problems, if you've had cancers and you've had treatment done to where your medication that you've taken does things to your bone. If you're at an advanced stage, you're in your geriatric years, maybe let's just say 70s and 80s, and you want to do an implant, that's another issue as well. You maybe have osteoporosis, arthritis, all those factors they play into having an implant. Some of the major issues is people that have had cancers, unfortunately. The treatment that is done, it affects everything, including your bone. And sometimes it's not even an option, but again, we have to go through the history, how long you've been treated, what has been done, and where you're at now. If you haven't had any of those past ailments, then we need to get an authorization from your provider, your medical provider. More than likely you have a few of them if you have medical problems. So again, if you had cancer treatment, you're going to have a barrage of providers, and we'll need to talk to them as well to get authorization and clearance. If you have any issues with your heart and you're taking blood thinners, the common ones are Coumadin and warfarin. Those are pretty much the standard brand names. There's new ones out now that are doing the same thing basically, but we need to check that out as well to make sure, again, that either we can get you off of the warfarin or we can lower the dosage to get you at a lower level. Those are important to understand as well. Basically, it's just like doing an extraction if you're on a blood thinner, or let's just say you're healthy and you don't take blood thinners, but you had a little too much to drink the night before. You had Cinco de Mayo, which just passed over here. You have a lot of drinking, and now I'm going to go on Monday or the next day unless you'll get me some implants done, or even a simple extraction. It's a blood thinner. Taking too much acetaminophen, your aspirin, that's a blood thinner as well. So you got to be cautious of what you're doing the day or the week of your treatment to make sure that you're going to have good success healing with your implant. So those are pretty big key points that we're focusing on.
Yeah, for sure. So again, any type of care that breaks skin that is pretty extensive, we'll call it breaking skin. Right? Anytime you see blood, that's a pretty critical area. So and thank you, right? So Matthew gave you an idea of what really happens behind the scenes, but it's absolutely true, right? So from a dental director's perspective, there is pre-op, so pre-care or pre-treatment considerations. You mentioned talking to all of your doctors if you have different doctors. It's looking at your comprehensive medical history, previous procedures, and then previous or continuing ailments. Those are huge, right? That can affect a lot of different things. And that's just really qualifying somebody for can they even get an implant, right? And that's just the beginning of it, right? If that determination has been made by the specialist, and a lot of times they're the periodontists or prosthodontists, they have their own specialties. These are specialty dentists. right, then the real fun begins, right? Then it's going through the charts, going through the procedure, going through the notes, going through the treatment plan for that specialist, and then looping in, Matthew does this, looping in your dental assistant, all right, and then adding on to the team, right? Who else do we need? Do we need somebody maybe helping with drawing blood? Do we need somebody working with almost like triaging?
Checking vitals and that sort of thing. Yeah.
Exactly, right? I mean, think of it as like a fully operational operatory, right? You're doing an operation. Sure, it's not open heart surgery,
Right.
but you need to think of it. You need to think of it in that way, so that everybody goes home, everybody gets the best care that they deserve, and you know that's the nature of it. That's the reality of it. And on top of that, right, there's scheduling concerns, right? There is planning concerns. There is preparation. And it really takes a village, right? It really takes a village. So to that end, we'll call them patient X, right? So one of the really cool cases was patient X, and simply because not only was it a complicated surgical procedure, but there were also, the complexity of it was really cool, which we'll get into, but also there were complications as well. Right, so can you talk some more about I guess start with the
patient X,
complications, and then what the aim of the procedure was, and then what came up along the way that made it just like a oh my goodness, eye opener.
Right. All right. So with patient X, and again, this goes back to your background, your past. What is your practice and what is your specialist team, i.e., like an implant? What do we have to deal with to get to the point where we can safely place an implant? Now, there's so many different situations and scenarios, but this one in specific it was pretty complex, only because the area in which we needed to place an implant, two of them rather, was an infected site. Now, that's never a good sign. You have an abscess, patient X has abscess, and we had to control that. Ideally, traditionally, without advanced care, without advanced specialists and advanced implants even, you have to traditionally pull those out, remove the infection, let it heal months and months and months, and then go in and take a look at the bone, figure out what's going on. But to make matters more difficult, the patient had a blood thinning issue, so they were on a blood thinner. Now, being on a blood thinner, one red flag, having infected teeth, another red flag.
Big, huge red flag.
Absolutely, and having that be in control of that blood, the blood thinner, couldn't even get off of it, so that was another safety issue. So we had to be able to still provide care, remove the infection, place the implant, and control bleeding. That's all like the the trinity right there of hard procedure. So what we had to do to counter all this was removing the teeth one at a time. Now, two of the teeth that we removed, four. Two of the teeth were fused together in a bridge. It was basically you've got a tooth here, a tooth there, and the empty space in the middle. Well, both of these teeth that were anchors were bombed out at the bottom. They were infected. There was another tooth behind it, singular. It wasn't connected to anything. So we removed that one first. Now, before you do that, even though the patient's at a stable level with the blood thinning medication that they're on, the only way that we could safely do that, and doctors know this, you can use some kind of a hemostatic agent that will help slow the bleeding down and ideally stop it, which everybody knows in professional world, to stop bleeding you need a lot of pressure and a lot of time. Well, when you're on blood thinner for decades, it's who you are now, so it gets very dangerous. An advanced procedure that we performed on this patient was PRP, PRF. Platelet-rich plasma is the byproduct, and platelet-rich fibrin, which is a clot. That's what's utilized after drawing your blood. It's spent in a centrifuge, and it's basically the building blocks of where a clot starts. So what we did was we drew blood and had that in vials, spent it in a centrifuge, and separated the plasma from the blood. And that plug, basically is what it's called for lack of a better word, the plug was utilized to stop the bleeding in the socket. Oddly, it didn't happen the way we expected, which was a lot of bleeding occurring, and we were going to have issues controlling the bleeding, but we were going to try anyways and see how it went. But just for sheer happenstance, we were already there. We had the PRF available, and we went ahead and put that in there. The minute bleeding that occurred after we removed the infection, we had to actually go in and remove the infection to create bleeding, basically. Once that occurred, we put that plug in, and it immediately stopped it, because again, that's the building blocks, that's the scaffolding for blood to basically absorb and then start to clot. So the minute that plug was put in, it stopped the bleeding instantly, which was amazing. It's a very advanced procedure that is done by our specialists, and it was beautiful to see. So it makes the procedure safe. There's no hemostatic agents that you need at that point if you're doing that type of a procedure, PRP, PRF. So I mean, again, it's better for the patient. It's your own platelets, so you don't have to worry about integration issues. So it worked out well. So we pulled the teeth, went to the other teeth, pulled those out, and put the PRF in there, and everything was beautiful. We were able to place the implants as well. We soaked the implants in the plasma. That was the byproduct, which again allows for a rapid integration of the implant. And we were able to put an implant in an infected tooth. That's crazy. People just can't do that without the proper training, without the proper knowledge, without having never done that. You know, it's not possible. You have to make the patient wait months and months, and even then you've got to check to make sure there's no prior infection. But doing the procedure the way that it was done created the success that we got, and the patient's doing well, not having any major issues, a little minor swelling still, but it's almost like night and day for her. Got rid of the poison, took care of the patient, and she's doing 100% better now. And she got her implants. Pretty amazing.
That's all in one. That's 3 separate medical dental issues rolled up into basically one complex, monstrously complex medical ninjutsu, and then patient X is now very, very happy, right? So let me roll that back, all right? So first of which is blood thinning. Anytime that you get any sort of procedure, even if you get hurt, blood thinners will make you bleed and bleed and bleed and bleed. Hemophiliacs have this natural ailment where their blood can't clot, so for them it's particularly dangerous. Even bruising, right, could give them
internal bleeding.
And then they die from that, or not knowingly, right? So it's extremely dangerous. And so when you're talking about patient X that has been on, maybe a more advanced stage, right? For one, that makes healing already nice and slow, right? For those of you who know, it sucks. You heal slowly. You can't go to the gym, you can't work out as hard. But for medical procedures, right? So that's already a big one, which is the bleeding issue and blood thinners. The next one was you talked about PRP and PRF, right? Essentially, it's taking your own body tissue, the plasma, like Matthew said, it's the scaffolding in the blood. It's the non-colored. So I call it the gummy bear, right? So when you see this thing,
that's good. I like that.
Yeah, it's the gummy bear, right? And then you guys will see this too. Hopefully this is cut in the back shot or the B-roll segment as we're talking about this, so it's not just us talking. It's good looking as we are. But it's like that gummy bear, and like Matthew said, as soon as it touches the infected site, or as soon as it touches the wound channel, the wound site, your blood knows what to do with it. It's like, oh, that's my tissue, that's my plasma, cool. Now we can start clotting the blood around that.
Sure.
Right, and then the third issue is, in addition to all of that, right, blood thinning, infected bone, infected site, and then having your profuse bleeding concern, massive, because people die from that when they bleed out. Literally, it's called bleeding out. Then on top of all of that, Dr. Ilya put the 2 implants in. So, okay, I said 3, but it's actually 4. 4 massive procedures, all rolled up into one session. And patient X did, fabulously.
Oh, it was a royal treatment right there. It was a team. We set aside the team. As many, I think it was like a 6-hour, 5.5 to 6 hour procedure.
Which is quick.
Which for all that.
For all that is astronomically quick.
Exactly. And in her condition, that was a major issue. So it would not have been able to be done. And even still, traditionally, we already know that in order to get to the point where we did, what was it, a week of planning preparation? It was some hardcore, like you said,
at least,
ninjutsu. Get it done. Just figure this out. Just take care of her and move on. And that's something that doesn't happen. Everybody knows you go to a specialist, you go to your clinician. It's going to take time to get in to get seen. Then it's going to take time to get referred out. Then it's going to take even more time. Well, what we did in a week would have taken 3 to 6 months minimum from start to finish.
6 to 8 visits because of the complications. That's going to be the average for somebody looking at implants. 6 to 8 visits with your regular dentist as well as with your specialist, the ones who's actually doing the implants, right? But the benefit of what we do at Elegant is that somebody like Dr. Ilya, right? He's part of the ninja team. This is like ninjutsu. He did all of that, the 6 to 8 months minimum, the 8 visits, 6 to 8 visits, sometimes 9, sometimes 10, especially with complications, one sitting, bam.